As 2016 draws to a close, it's a very fitting time for me to express my sincere appreciation to all members of staff for the fantastic work that's been carried out during the course of the year. At this time, it's not only important to look back at all of the achievements of 2016, but it also gives us the opportunity to look forward to 2017, which is going to be an equally challenging year, and in some ways it's going to be a more challenging year. The financial climate that we are in means that we're going to have to continue to make financial savings while seeking to protect and maintain and develop the high quality of clinical services that we've got across the region here in NHS Grampian. And again, I'm really indebted to staff for working together, not just to identify savings, but to look for opportunities to make what we do much more effective, much more productive, and drive even higher quality for the patient services that we provide. In times of change, our values become even more important. It's not just the what we do, it's the how we work together. Our values of caring and listening and improving become increasingly important as we move into challenging times. And it's very important as an organisation that we continue to work together and that we work in partnership. We work in partnership with our Grampian Area Partnership Forum, we work in partnership with our professional advisory system, and we work in partnership too with our colleagues in local authorities and police and fire and rescue, our two universities, our College of Further Education. So actually working together and living our values become increasingly important as we move into more challenging times. In October of this year, we had our annual review, which this year was not chaired by a government minister, but was chaired by our own chairman, Stephen Logan. It was held in public, and it's a real opportunity for members of the public to come along, ask us questions in a public environment, and for us to be held to account by the public for what we do and for how we do it. In the follow-up letter to the board, I was particularly pleased to read the Cabinet Secretary's comments about how we had gone about integration, our close partnership working with our local authorities, and the very successful establishment of our 3 integration joint boards across the region. And I want to pay a real debt of gratitude to our 3 chief officers, to the 3 local authority colleagues for really making sure that we get those integration joint boards successfully established. And I think that's been one of the real achievements of 2016 and stands us in very good stead to really build up healthcare and community care and social care in primary care and seeking to transfer a lot of our work into primary care and community settings. So it really does put us in very good stead for the future. So as we set our sights on the future of 2017, what we can do is to build on the successful launch of the Grampian Clinical Strategy. That's been a really important piece of work in 2016, and it's involved listening to a wide range of staff and stakeholders about how we want the health service in Grampian to look like, not only now, but in the future. And that clinical strategy has really set the base for the approval of the new Inverurie Health Hub, which I was delighted to see signed off just at the close of the year, and the new Forester Hill Health Centre. Work's now getting underway on both of those projects, and that sets the scene too for the successful development of the new Baird Family Centre and the Anchor Hospital as well. So these are major important projects for the NHS in Grampian moving forward. And I was also delighted to receive the feedback from Scottish Government about not only are the projects of a very high quality, but how we've gone about them in terms of listening to the public and listening to members of staff and developing those projects that are actually going to meet the requirements of the users of the service and are going to be exemplary in the way that they are designed so we can get maximum benefit from them. So again, I think that's one of the themes for 2017, not just the what we do, but the how we do it, how we listen, how we engage, how we involve, and how we work together really to develop our health and social care services here in the northeast of Scotland. Last Thursday, the Cabinet Secretary announced the budget for Scottish Public Services for the NHS and for the NHS in Grampian. We're currently analysing the details of all of that budget, and we plan to be in a position early in the new year to discuss the detail of that with our board, and thereafter to engage with a wide range of staff and our local authority partners to set the budgets across NHS Grampian and for our 3 integration joint boards. So there's a lot of work to be done. There are many challenges in there, but I do believe that by working together, working to a common aim in and around our Grampian clinical strategy, we can achieve real and continuing success here in the northeast of Scotland. And finally, I'd like to wish all staff a really good break over the festive period, and to say that those members of staff who are working, thank you. Thank you to you and to your families, and those members of staff who've got time off, I hope you really enjoy a well-earned break, and thank you for all of the work that you've done over the course of 2016. And I think we've got some real opportunities to work together in 2017. So thank you for everything that you've done, and enjoy a really good Christmas and New Year break. Thank you very much indeed.